muscle should really not be hurting after lipedema surgery if it's done properly. If that surgeon is staying purely in that layer of subcutaneous fat between the skin and muscle and not poking and jabbing into the muscle, there should be no trauma to the muscle. There may be for a couple weeks a little bit of soreness from bruising, that maybe some referred pain, feeling like it's coming from the muscle, but the muscle itself should not be damaged and traumatized with liposuction surgery if that surgeon stays in that plane. Now, my feelings about general anesthesia and liposuction is that that is where a surgeon potentially can be poking or jabbing into the muscle or something deeper and damaging that muscle, causing bleeding and bruising and pain afterwards. And I would say that commonly occurs under general anesthesia. But under purely, when the patient is conscious, that surgeon only should be staying in that layer of fat and not be damaging that deeper tissue, such as the muscle. There really should be no muscle pain after liposuction surgery done properly, staying in that layer of fat. Liposuction, whether it's lipedema or not, can be done virtually anywhere safely, as long, again, as that surgeon is staying purely in that layer of subcutaneous fat and respecting that between the skin and muscle, and is skilled enough to do that. You know, one of the most complicated areas is really the ankle area in terms of approaching that very thin layer of fat all the way around with nerves and blood vessels closely down underneath there. And that really applies to everywhere, including the rib cage, the upper part of the stomach, the neck area, the under the arm area. Any area of the body can really be done with liposuction as long as that surgeon is staying in that plane of fat. The forearms, for example, again, a very thin layer of fat that curves around. I do liposuction on the wrist, for example, as part of treating lipedema. So again, any area can be done with liposuction, keeping in that proper plane with proper technique.